surges, in part driven by the Delta variant. And our share of global cases and death is rising sharply. In the first 3 weeks of August, our regions reported over 10% of new global cases and more than 8% of new global deaths. And in some places, surges are pushing health system dangerously close to what we call the red line, where the number of critical cases exceeds ICU capacity and the hospitals can no longer provide the care that people need. This is a serious problem for all of us, but it weighs especially heavily on doctors, nurses, and other healthcare workers. They have worked day and night for a year and a half, and some have not been home to see their families for months. Several factors are contributing to surges. To explain this further and provide an update on the outbreak in the region, I'd like to hand over to Dr. Matsui. Tamano, please.
Thank you, Dr. Kasai. Distinguished member of the media, good morning. I will share with you the COVID-19 situation in the WHO Western Pacific region. Next slide, please. Here is an overview of the situation of COVID-19 globally and in the Western Pacific region. The left side of the screen shows the global situation, including a graph with a trend in the 6 WHOs. Some regions has had a plateau or declining trend in the past 2 weeks. The right side shows the situation in the Western Pacific. As an illustration of the recent situation, in August, 10% of new global cases and 8% of new deaths were in the region. If we look at the trend here, we see a sharp increase in both cases and death reported recently. Next slide, please. The slide shows the 4 countries in the Western Pacific region with the highest number of the new cases in the previous 24 hours. Recently, many countries in the region have reported an increasing trend in cases. Factors that have likely contributed to this increase include widely circulating virus, especially Delta variant, insufficient and/or no compliance with the public and social measures, such as closure of CC settings, mask wearing. Another important factor is the difficulty in detecting cases that are asymptomatic or mild. These cases can maintain chains of transmission in the community. Next slide, please. While we see increase in many countries and areas in the region, some member states, including China, Singapore, and Mongolia, have suppressed transmission. Factors contributing to this suppression include early implementation of public health social measures after detection of community transmission and high vaccine uptake among the population. The combination of early implementation of public health social measures in addition to vaccine uptake has been shown to be effective at reducing transmission. This is also true for transmission of the Delta variant. Next slide, please. Some countries and areas in the region have reported no new cases for 7 or more days, as shown in the table on the left, and 10 Pacific Island countries have not reported any cases to date, as shown in the table on the right. Next slide, please. The proportion of COVID-19 cases which are caused by the Delta variant is increasing in several member states in the region. This slide shows the key characteristics of the Delta variant. In terms of how easily it spread, Delta has the highest transmissibility of all variants concerned. Studies suggested that Delta is nearly twice as infectious as previous strains. Regarding disease severity, some data suggested that Delta may increase the risk of severe cases in unvaccinated persons who are infected. However, these findings have not been consistently observed globally. Regarding vaccine performance, existing vaccines continue to be highly effective at preventing severe diseases in fully vaccinated individuals, including those exposed to Delta. Next slide, please. Here you can see the progress with the COVID-19 vaccine supply for eligible population in Pacific Island countries and areas. We define the eligible population in these countries as 75% of the island's overall population, because they have a bigger proportion of high-risk group than other countries. As we can see in the graphs, all have secured vaccines. Next slide, please. Here is the same information of vaccine supply in the other countries and areas of the region. Overall, in the Western Pacific, with the combined efforts of government and partners, we are making progress in securing vaccines, especially for priority groups, healthcare workers, the elderly, and people with comorbidities. The region already has enough doses to protect all healthcare workers, around 26 million people. We are also closely monitoring progress with vaccine uptake in the region. Next slide, please. Here is a takeaway message. Considering the higher transmissibility of the Delta variant, early detection of community transmission, and implementation of public health social measures are key to suppressing transmission and minimizing impact. Stronger and longer public health social measures may be needed to avoid big increases. Vaccination helps to prevent severe cases, so vaccination of high-risk population groups is important. Lastly, vaccination should be paired with appropriate public health social measures. Thank you for your attention. Back to Dr. Kasai.
Thank you very much, Tamano. As you have just heard, the Delta variant is now a real threat, which is testing the capacity of even the strongest public health system in our region. Delta's higher transmissibility means cluster of cases are quickly leading to bigger outbreaks, especially in the high-risk setting known as the 3 Cs: closed space, crowded places, and close contact settings. We are also seeing more clusters in the families. Once the virus enters the household, more family members are quickly becoming infected. And this is the reason why government in the regions are taking strong and early action through lockdowns and other measures to limit transmission and avoid putting more pressure on already stretched health services. Every country needs to continue doing all that it can to control the viruses, carefully assessing and managing the risk in each context. It is especially important for countries which still have a few or no cases to remain vigilant. We have seen how quickly Delta can spread once it gets in and how hard it is to stop. However, even with all our best efforts, it now seems clear that globally, the virus will not disappear, at least not in the near future. And while the virus is spreading anywhere, every country remains at risk. With this in mind, we see a couple of plausible scenarios for the future. The first scenario is where our action allows us to live with the virus. We reduce the risk it poses by making the best use of vaccination and other prevention measures and respond to flare-ups where they occur with short targeted measures. This does not mean giving up on controlling the virus, but it's more like how we manage seasonal influenza and other vaccine preventable diseases. We focus on trying to limit spread, protecting the most vulnerable, and doing so reduce the health and broader social impact of outbreak. The second scenario is where other more dangerous variants are able to evolve. Variants that spread even more easily, cause more severe diseases, or are resistant to existing vaccine. I'm sure you agree that this scenario and all of the associated health, social, and economic cost is the one we don't want it, and we wanted to avoid if possible. And the best way we can do this is by doing everything we can to limit the transmission now. Like other viruses, the more people are infected, the more the virus will cause COVID-19 can evolve. Which of these two scenarios becomes reality depends on which individual and collective actions we choose to take in the weeks and months ahead. So it is in our power to shape the course that the pandemic takes next. Getting priority populations, especially health workers and older people, and then whole communities, vaccinated as quickly as possible is crucial, but equally critical is continuing with the personal protective behaviors and public health measures that reduce transmission. Using these tools in combination is the key to limiting spread and the virus ability to mutate into more dangerous variants. I know that it's hard to keep asking people to comply with the restrictions and to keep asking government to apply them when resources are stretched and people are tired. I totally understand, because I am also tired of all of these too. I want to be able to travel again. I want to see my elderly parents and for my daughters to see their friends. But at this critical points in the pandemic, it is up to all of us to stay the course and do all we can to avoid the second future scenario. For individuals, this means continuing to wear masks and avoid closed spaces, crowded places, and close contact setting. And of course, getting vaccinated as soon as it becomes your turn. For business and other employers, it means carefully managing and mitigating the risk at the workplace. And for health system, it means staying ready for potential surges and maintaining essential services to save lives. And for governments, in addition to rolling out vaccines, it means having the best information to support decision-making and adapting measures based on the local context. It also means taking the right approach to testing with genomic sequence to track the variants, and contact tracing to find and stamp out clusters early, and taking targeted actions to reach and protect vulnerable groups in high-risk settings. A lot remains uncertain, but at this critical moment in the pandemic, we must continue to make the best decision we can based on our experience, shared learning, and reliable data in order to create the future that we want. It is within our power to reduce the threat of the virus, but by making the most of every tool we have to fight it today. Doing this will help us get back to something closer to the life we all want. Just last Friday, I had a video call with a 108-year-old woman in rural Cambodia who had just been vaccinated. And she told me that she took the vaccine for herself and to help protect others in her community. Every day, I'm inspired and motivated by the tremendous resilience and commitment of people like her from across our region. We have come this far together, So my message to all of you is this. At this critical phase in the pandemic, let's stay the course. Working together, we can take control to protect ourselves and each other for the sake of all our futures. Thank you very much. Back to Liv.
Thank you so much, Dr. Kasai and Dr. Matsui. We've now come to the part of the press conference where we take questions from journalists. We already have a very long list of questions. As I said, we'll get to as many as we can today and follow up with us afterwards if we didn't manage to get to your question. And also those who still have a question that they haven't yet submitted, please feel free to do that using the Q&A function in Zoom. So let's start with a question that we have from Bin Wu with China Southern Metropolis. We have a question from Bin Wu about the Delta variant. We have lots of questions about the Delta variant, obviously a topic of great interest. But let's start with this one. In the Western Pacific region, we've seen a big increase in new cases and new deaths in the past week. What are the reasons for this? Does the high infectiousness of the Delta strain, as well as its high pathogenicity, have anything to do with it? I'll turn to Dr. Kasai for a response to that one.
Thank you, Liv, and thank you for that question. In our region, the situation in every country's areas is different, and situation can change very quickly. Some countries have still a low case number, and others are fighting major surges. Several factors are contributing behind these surges, as my colleague Tamano explained. And one is Delta variant, which is reported to have twice as transmissible compared to the original virus. The other reason is after 19 months, people become tired of, and there's a lack of compliance to the preventive measures. And even there are some people who start to lax about the preventive measures. And the third reason is that invisible transmission from the people who don't know they're infected. And obviously, for those groups, it's very difficult to detect early the case. And I wanted to also add one more challenges that our regions face, exist in our region. That is that we have the area where people becomes vulnerable. There are area that the people living in the very crowded place and sometimes not hygienic. People from the province or outer island come to the urban setting or main island to work for it. That creates that kind of space. And sometimes the dormitory of the factories are also making people in the vulnerable conditions. Know it works in combinations and stay on course. Thank you very much.
Thank you so much, Dr. Kasai. And thanks for that question. Next, we're going to take one from Peter Blaser with Reuters. Peter has a question about booster doses of vaccine. We've got lots of questions about boosters. So let's start with this one. Other vaccine manufacturers are proposing booster shots to improve immunity responses. Will WHO recommend these boosters in future? And with the lack of supply, how can developing countries afford booster shots? I'm going to ask Dr. Escalante to take this one. Thank you.
Thank you so much, Liv. Indeed, there have been a lot of discussions on whether or not booster doses will be provided to individuals who have already been vaccinated. And there are initiatives or studies that are already being undertaken to determine the needs of booster doses with several considerations, and one of which is to really look at whether or not there is a waning protection of the current vaccines against severe disease, and whether or not the effectiveness of the vaccines are reduced against the variants of concern. However, at this point in time, we really do not have sufficient evidence to say that we need these booster doses now. And especially within the context of the very constrained global supply, our priority will be for countries to ensure that the vaccines that are available to them are used to cover the priority groups, including the healthcare workers, the elderly, and the vulnerable. But WHO will continue to work with scientists and experts around the world to continue with these studies. But we are also really urging that the introduction of booster doses should be firmly evidence-driven and targeted to the population groups in greatest need. Again, for now, the focus should be ensuring that countries use limited vaccine supplies to fully vaccinate people with first and second doses, again, especially the priority groups or the most at risk, who are most at risk of infection and to vulnerable disease. Thank you, Liv.
Thank you so much, Dr. Escalante. We've got a lot more questions on vaccines, so let's now go to this one from Janice Cave with Philippine News Agency. What is WHO doing to ensure that vaccines are distributed equitably across the world? And we've got a similar one from the Philippine Star. Can you address that as well, please, Sok?
Sure, thank you so much, Liv. During the first months of the rollout of the vaccinations, we have seen enormous inequity in the distribution of vaccines, and still this is quite persisting. However, WHO and partners are focused on ensuring that the equitable distribution of vaccines will be addressed at the soonest possible time. The COVAX facility, which is an initiative of WHO, Gavi, SETI, and other partners, continues to work with suppliers and manufacturers around the world to ensure that the doses they produce are shared with COVAX. Also, recently, we have seen more and more countries, particularly those with extra doses, already donating to COVAX and sharing their doses to countries with less access to vaccines. We are also very happy to see that many countries in our region, the developed countries, are contributing enormously to COVAX, whether that will be financing or whether vaccines that are manufactured in the countries, and also the extra doses. So many of the countries in the Western Pacific region, including for the Pacific Island countries, are benefiting from these shared doses through the COVAX facility. On the other hand, one of the issues that we are really facing is the capacity of manufacturers to scale up production, particularly for the very new platform of vaccines. So again, WHO, working with partners, has launched the initiative of technology transfer to enable manufacturers in low and middle income countries to adopt the technology for the production of vaccines and to sustain the supplies in the short and medium term. And we are seeing that progress very, very well, including some of countries in our region participating in the technology transfer. Thank you, Dave.
Thank you so much, Dr. Escalante. We've got lots more questions coming in. So now let's go to one that we have from, also another one I'll ask you to respond to, Sok, about vaccination of other groups, including children. This is one from the Inquirer in the Philippines. What is WHO's take on giving booster shots, third doses? I think you just responded to that part, but what about vaccinating younger populations in the Philippines? On the vaccination of children, WHO will only recommend vaccination by age group based on the evidence available. Over to you, Sok.
Thank you again, Liv. In general, children are less likely to suffer from the direct impact of COVID-19 morbidity and mortality compared with other age groups. But there is still a small risk of developing severe illness and complications from COVID-19. So WHO is recommending to countries that where children have comorbidities, and if these children are in places where there is ongoing community transmission, as well as the formation of clusters, then children could be vaccinated. But again, we still need to put that in the context of prioritizing the elderly, which are more vulnerable to severe disease.
Thank you so much, Sok. And in fact, another question that was very similar just came in from Greg Gregorio with TV5, but I think you've responded to that adequately already about children. Next, we have a question about other variants of the virus. So let's start with this one from Maricar Cinco with The Inquirer. Following the detection of the Lambda variant in the Philippines, what does WHO recommend in terms of community quarantine or lockdowns and travel restrictions? How do we foresee the COVID-19 situation following the detection of Lambda variant? There's a similar question from Rappler, but if you could respond to that about Lambda and other variants, please, Tamano, that would be excellent.
Thank you, Lee. WHO Virus Evolution Working Group monitors the changes to SARS-CoV-2 to detect potential variants of concern and variants of interest that pose an increased risk to global public health. A variant of concern is a strain with a characteristic including increased transmissibility, change to clinical disease presentation, or decrease in effectiveness against vaccines. In recent months, Lambda has become the dominant variant in several South American countries. WHO has designated Lambda as a variant of interest. This is different to being a variant of concern. WHO has been monitoring this variant for some time, and there is the evidence that this variant is overtaking other virus variants in some countries. However, to date, there is no evidence to suggest it has a greater transmissibility or that current countermeasures are not effective against it. Thank you.
Thank you so much, Tamano. We also have a question from Red Mendoza at the Manila Times about how governments are incentivizing vaccination. There are proposals to allow only vaccinated people to roam around and enjoy things like dining and public transport. What does WHO think about these proposals? Would it help to convince people to get vaccinated, or are there other ways to incentivize people to be vaccinated and push them to get the shot? I'll put that question to Dr. Kasai.
Thank you, Liv. Vaccination is a very important tool for controlling this virus. And continue to communicate about the COVID-19 and its vaccine is a very important steps to make or help people inform decisions. But in the same time, it is important to consider what encourage people to get vaccinated. And it depends on the actually each country's context. But environment that makes people easy to get vaccinations can promote vaccinations. And in fact, that there are several examples exist. There are so many innovations coming out from the grounds, such as providing the transportations for elderly or bringing those vaccination sites closer to where people live or closer to where they go. So it is always very important to consider how can we make a vaccine uptake speed up and easy for people to get vaccinations.
Thank you so much, Dr. Kasai. We have a question from Amelia Dunn with SBS Australia about the Pacific Islands and how they're coping with COVID-19. How has Delta changed the approach of the small island nations to containing COVID? Are they receiving enough vaccines? A lot of countries still have their borders closed. Do you think this is going to change anytime soon? And what are WHO's major concerns when it comes to keeping Pacific Island countries safe and their health systems working? That one for you as well, please, Dr. Kasai.
Thank you very much for these very important questions. The Pacific Island countries is the priority area for us in responding to COVID-19. And together with the partners, we're working closely with the countries. The Pacific Island countries are vulnerable to COVID-19 with their limited healthcare capacity, but also they have a higher proportions of the people with the risk to COVID-19. And also, obviously, they have challenges of geography. And many of them actually took a strong border measures and keep a virus out from their countries. But unfortunately, several countries are now experiencing the surge as other member states in our regions with the Delta variants. And with the Delta variants, actually, many of them enhance the border control, including the travel restrictions and the testing strategy. But keeping a border control for an extended period is costly. And if you think about long term, it is not possible to maintain those very strict measures. And so vaccine and the risk-based approach is going to be the key. Fortunately, as my colleagues reported, with the strong partners exist in the Pacific, strong partners such as Australia, China, New Zealand, Japan, and United States, so many other partners are already made a commitment to make sure that the sufficient vaccines to be available for the Pacific Island countries. But not only the partners, there's also a solidarity, and the governments are really taking their best efforts to deliver those vaccines once they get it as quick as possible, even to the remote island, and showing a very impressive progress in that. And with that, several countries start discussing a risk-based approach to relax the border step by step. But again, important things is that the vaccine alone cannot make a virus under the control. And it's very important to continue to put the public health and the social measures. And if you think about the risk-based approach, the more we have the vaccine coverage and the more stronger capacity for the border control and response and health system, the more we can open the border. And therefore, it is very important to continue to put the effort in strengthening all those capacity. Ideally, if it's possible to continue to encourage people do basic preventive measure, but if not, it is also important to make people, community ready to quickly switch on in case they found new viruses within their country. So, under this Delta variants, it is a very important phase for the pandemic. And we encourage all the countries, even the country where they don't have the virus yet, to ramp up their effort to strengthen all those capacity and stay on course. Thank you very much.
Thanks, Dr. Kasai. We have a couple more questions specifically on the Pacific Island countries that have come in. These ones focusing in particular on vaccines. I will put them both together now to Dr. Escalante. One from Samantha Magic with Islands Business. And she asks, I note while all required vaccines have been committed for PNG, Solomon Islands and Vanuatu, vaccines actually received sit at below 20% and just 8% for PNG. What are these delays in deployment due to? And what concerns does this raise for WHO and your partners? The second question is from Lucy Kramer with Stuff in New Zealand. What are the biggest challenges for getting populations in the Pacific fully vaccinated? And how is access to vaccines there compared to access in other regions? What vaccines have been made available there? And is there a preference for one type of vaccine over another? I know that's a lot, and sorry for doing it all to you at once, Dr. Escalante, but perhaps you can get started on that, and others, if they want to complement, can do so.
Thank you so much, Liv. I will try to answer all the questions as much as I can. When the Western Pacific region planned the rollout of vaccination, there are three important key elements in that plan. One is on access and availability, and that is to ensure that the doses of vaccines that are already listed as safe, of good quality, and of known efficacy will be accessed by the region as soon as possible. And on that aspect, we are seeing a lot of progress in terms of access and availability. The second would be deployment. And deployment is very challenging in the context of the COVID-19 vaccinations because it is a very unique situation where it is the first time that we are going to deploy vaccines to very large number of populations, of course with a priority and across all the corners of countries and in the region. And third is to ensure that countries will be able and have the capacity to monitor the safety of the vaccines, and when adverse events occur, that they are able to respond and to manage these adverse events in a timely manner. So with this, it's a constellation of complexities and many challenges. What we are seeing in the Pacific Island countries is, again, the governments are very good on ensuring availability of the vaccines, but because also of the geographical makeup of the PICs, the deployment has become a challenge. The deployment and implementation of the vaccines. We are monitoring the weekly uptake of vaccinations in these countries, and countries have been faithfully and committedly reporting to WHO. There will be implications because WHO and partners and countries donating do not want vaccines to be wasted when they are received in the country. So the work now that we are doing is to support countries and partners to pace and sequence the donations so that when the vaccines arrive in country, the countries are ready to deploy. So we are seeing, for example, in Solomon Islands and Vanuatu, particularly in Vanuatu, a slower uptake for now, but because they have also started their vaccination quite late. PNG, we are seeing a lot of issues on vaccines hesitancy, and WHO, the country and partners have been extensively working to address this through appropriate and timely risk communication, but also looking at the micro planning on how the vaccines are targeted to the populations and delivered as much as possible in a more rapid manner. But again, yes, we are seeing all these challenges, but we continue to work together with the countries to address these issues.
No, I think you answered very well. But only things I wanted to remind is I mentioned in the previous questions that they have been showing a very impressive progress. The way I expressed was because of that, all those challenges or the difficulties they have, despite of that, they're really trying to distribute the vaccines. They have been successfully, pushing the virus out. Means the people living inside that countries had less access to the information of COVID and have not really ready or understand what this COVID-19 means and then what is the effectiveness of the vaccines. But still, they're really explaining and communicating well, and then making a community to start take action themselves, not just protecting yourself, but protecting the community. And that's the reason why in the previous questions, I mentioned that we're seeing very impressive progress. Thank you.
Thank you so much, Drs. Escalante and Kasai. We have a number of questions on the current situations in the Philippines specifically. And one of them is this from Alison Jackson with AFP, but we have similar ones from Dario Agnote with Xinhua Agency and also from GMA News and UNTV. But let's start with this one from AFP. What is your assessment of the current surge of coronavirus infections in the Philippines and the preparedness of hospitals to deal with the sharp increase in cases? Do they have enough nurses to handle the patients? And specifically, what about hospitals outside Metro Manila? What's your assessment of their capacity to cope? Has enough been done since the last surge to boost their capacity? Over to you, Dr. Kasai, for this one. Or
okay, let me answer in a much more generic way, and then if it's not enough, I can pass it to my colleagues. So the Philippines is one of the countries in the regions facing this surge. Now reported more than 1.7 million cases and suddenly more than 30,000 deaths. And it is not only in the capital, but multiple provinces experiencing surge. We call it the pulse. And in some places, they are experiencing, the hospitals are overwhelmed. And then what I also wanted to share is that we heard that the healthcare workers are all really exhausted. The Philippines was one of the earliest countries to introduce public health and social measures in pandemic response. And they were able to reduce the number of cases, but also experience a negative impact on people's life. There are people who need to go for work. And it has been posing a very challenging situations. And the leaders have been making very difficult decisions. They have been adapting and then adjusting, and now put several strong measures in several places to control and reduce the transmissions again. We know lockdown alone cannot really reduce the transmission down. And so it is very important to identify and know where the infections are occurring and suppress that. And also using that information for risk-based measures so that you can effectively suppress the transmissions. And government has put in a significant effort in vaccinations. And I was very happy to hear yesterday that the vaccination coverage for the healthcare workers already reached above 95%. And for elderly, also the pace is really going up and reach more than 46%. And I wanted to really encourage people to continue to get the vaccine when the turn comes to your turn. They also continue to put effort to increase the healthcare capacity to respond to the surge. And the previous wave, we have seen that they have done in a very successive way in increasing the ICU capacity so that they can accommodate all those critical cases into ICU. But what is important is actually not just the beds, but to make sure there is a doctor and nurses, and also there's sufficient equipment, and also the support to those working very hard. And together with the partners, actually WHOs are working very close with the government to support all these efforts. And Delta variant is here in the Philippines. And like other countries in the region, it is a very important moment for the Philippines. And I really wanted to encourage everybody to take their role in protecting their loved ones and also the greater community so that we can stay on course. Thank you.
Thank you so much, Dr. Kasai. We have more questions on the situation in the Philippines, including this one from Lee Alves from GMA News. What is WHO's assessment of the pace and coverage of vaccination in the Philippines? And what are the areas that need improvement? Dr. Escalante, can you take that one?
Thank you so much, Liv. The vaccination rollout in the Philippines is going quite well. And as our regional director has already mentioned, it's very good to note that 95% of their healthcare workers, or more than 95%, have already received a full dose of vaccination, and about 46% of the elderly have already received full doses of vaccinations. So the Philippines has also demonstrated quite good capacity to rapidly roll out the vaccines across the country. We have seen that they have a very good plan of ensuring that when the vaccines are made available to the country, that they are distributed to the local government units as soon as possible. While some local government units have been better at planning and rolling out vaccines for priority groups, we also see that there is still some local government units that would need to improve the rollout of the vaccines and to target the priority populations, again, especially the healthcare workers, the elderly, and individuals with comorbidities. So WHO, particularly our country office, continues to work with the Department of Health and other partners in the governments, as well as with the local government units, to continue to accelerate the vaccinations, especially for the priority groups, as we have already mentioned.
Thanks so much, Dr. Escalante. We also have some questions about borders. Here's one from Ria Soko with EAC News Cambodia. When can you envisage a full reopening of the borders in the Western Pacific region? Do you want to start with that one, Dr. Kasai?
Thank you very much, Liv. Actually, I think when Cambodia referred to the border, they have an air border, they have a sea border, and they have a land border. And this land border is actually one of the area very challenging to manage. But the Laos, Cambodia, Vietnam, and China, they're really trying their best to manage this border. Back to your question, we don't know actually exactly when the border can be fully open. But what we know is that depends actually on the what action we take. And so the best way to get there is to stay the course and use the knowledge we have from experience shared from other countries, and use all measures we know it's effective: vaccine, public health and social measures, and also a border control, continue to learn and improve, and also strengthen the health capacity. Make that as a combination. Thank you.
Thanks so much. There's another question from Ria Soko in Cambodia about mixing different vaccines. Cambodia has been providing AstraZeneca booster shots or third doses to frontline workers who are fully vaccinated with Sinovac and Sinopharm. What are the possible effects of mixing vaccines, and do you recommend this? For you, Dr. Escalante.
Thank you, Liv. So the current vaccines that have been assessed under the emergency use listing of WHO have been tested in terms of their safety, efficacy, using the same vaccines. There were no clinical trials that were undertaken for the mix and match vaccines. While we were rolling out the vaccination and in the context of the constraints of supplies, other countries have considered mixing and matching vaccines. And we know that some countries, including the UK, have used AstraZeneca as the first dose and Pfizer as the second dose. And with the very limited data that is available, it seems that this combination is effective and also safe. However, aside from that, we do not have studies to show that other vaccines can also be mixed and matched. So from the perspective of the data that we know, the mix and match of vaccines such as AstraZeneca and Pfizer will only be recommended when the second dose for AstraZeneca is not available. But while we have vaccines that will be available for the second dose, we continue to advise countries to use the same vaccine to complete the doses of individuals, because those are the 2 doses from the same vaccine are already proven to be effective and safe, particularly in preventing severe disease.
Thank you, Sok. We have a question on the situation in Malaysia from Kanmani Batu Malai with Code Blue. Malaysia's decided to relax some restrictions based on vaccine coverage and the rate of new hospital admissions. These relaxations are now applicable to states with an increasing hospital and ICU admission rate for COVID-19. Is it a premature decision to relax the restrictions solely based on these indicators without considering the highly transmissible variants and vaccine efficacy against Delta, which seems to wane over time? Could you start with a response to this one, Dr. Kasai?
Yes, as I mentioned in my remarks, it's actually up to the countries to carefully assess and weigh the risk and then the effectiveness of the intervention and its social acceptance and its negative impact. The very important point for the COVID-19 response is not to rely on just one measure, but to make as a combinations. A vaccine is a good example. Vaccine alone cannot put this COVID-19 under the control, but together with the public health and social measure, we can suppress those COVID-19. And it is also very important to make sure that all stakeholders to be engaged, not just in the government, but also the business sectors or the communities or the NGOs and the civil societies to take the role and then the actions to reduce the transmissions. And when the number of the critical cases exceed the ICU capacity or expected to exceed the ICU capacity, that's the time we really have to take a strong measures so that we can protect the healthcare worker and then health services. And with the Delta variants reported as much more, might have higher transmissibility, it may take much longer time to see the effect of those interventions. And it is very important to carefully lift those interventions that they put in place. Thank you.
Thanks, Dr. Kasai. We have some questions now on the Philippines and challenges with vaccination here and how Delta's affecting that. Here's one from Carolyn Bonquin with CNN Philippines. What are the biggest challenges in vaccinating a big portion of the population in the region? And is the Delta variant affecting the vaccination strategy and targets? If so, in what way? To you, Dr. Escalante.
Thank you so much, Liv. As I mentioned in my response on the questions on deployment in the Pacific, the really biggest challenge of deploying, of vaccinating large proportion of populations would be, one is the availability of vaccines to cover this large portion of the population, and two is the deployment, meaning how fast we could cover these, like for example, adults as soon as possible. But again, in the context of that, I think the steps for the countries are really very clear to prioritize those populations who have the highest risk in order for us to effectively use the available vaccines and in order for us to systematically deploy the vaccines based on this prioritization. Now, in terms of the Delta variant, I would not say that the course of the plan or strategy for vaccination has changed. We would still need to ensure that the priority groups are going to be vaccinated first. But what countries would need to do is to speed up and scale up the vaccination so that we could cover the priority population as soon as possible, and to, as much as possible, be ahead before the Delta variant is going to spread. So again, in the context of this, we are urging countries to go to the last mile of vaccinating your healthcare workers and your elderly. For example, in the Philippines, if we are saying that 95% of the healthcare workers are already vaccinated, when Delta variant is spreading, let's find out who are those 5% that are remaining, and let us get
Press and others. But let's start with the Reuters question. Vietnam has by far the lowest vaccination rate in the region, and lockdowns may not be enough to keep it under control, as we're seeing in places like Australia. What do you think about Vietnam's current situation, given the mortality rate is pretty high and daily cases keep hitting records? And I also wanted to mention this one from Mi Hung from Dan Viet Online about the situation in Ho Chi Minh City particularly, where lots of 300 people are dying every day because of COVID, and they're focusing on mass detection in Hanoi and Ho Chi Minh to strengthen lockdowns. Is it working? And do we have any advice for Vietnam on how to improve the situation and speed up vaccinations? Again, it's a lot, but I'll hand all that over to you, Dr. Kasai, for a first response.
Thank you for that question. And I understand that people are very interested in the Vietnam situations. Actually, Vietnam has been demonstrating a very strong leadership and effective public health response, including contact tracing and social measures and movement control. And they had successfully suppressing the transmission. And as a result, while they're keeping a stringent border control, they start to lift their restrictions gradually. And then the Delta variant came in. Now, the over 323,000 cases and 75,000 deaths have been reported now. It is mainly in the Ho Chi Minh and their neighboring southern province, but they also have cases reported from many parts of the countries, including Hanoi, and many of them are unclear about the epidemiological situations. What we can see there is Delta variant is a real threat. But what we have observing is, again, with the strong leadership, Vietnam took a very stringent measure in a proactive manner. Here, when I say proactive manner, stringent actions, one is that they continue to do the contact tracings, and then they rapidly increasing the availability of the vaccines, and then they're providing the care to the sick, and of course, stringent public health measures. Regarding the vaccines, the Vietnam is also one of the countries encounter the challenges that many countries around the world face, that is the global shortage. But again, with the very strong leadership and the support from the partners, they are rapidly increasing the availability of the vaccines. And one thing I wanted to also note is that Vietnam is the country, once vaccines landed, they really speedily deliver these vaccines to the people. And I understand that they also moving the plan to have the vaccine production capacity within their countries. I was told that there are so many healthcare workers, doctors, nurses are being mobilized from other provinces to help those provinces that they are really encountering these difficult challenges. And I wanted to take this really opportunity to thank those hard work. And then WHO wanted to WHO commit to continue to work with the governments to support their effort to make sure that they can stay on course. Thank you.
Thanks so much, Dr. Kasai. I realize we are just over the hour, but with everyone's tolerance, hope we can answer just a couple more questions before we finish. We've got one here from Ella Marge with National Public Radio about the origins of the virus that causes COVID-19. Is WHO still mulling the reinvestigation of the origins of the virus, and what is at stake on finding out about the virus? Over to you, Dr. Kasai.
Thank you. To better understand how this pandemic began is very important for us to be better prepared for the next one. And WHO has been working closely with the member states and scientific community on this issue. And just recently, an open call for an expert of the new scientific advisory group for the origins of novel pathogens at the global level was announced. This work is important, but in the same time, we really must continue to focus on measures we can do now and continue to respond to COVID-19 at the regional and then country level. Thank you.
Thanks, Dr. Kasai. We have a question from Jenny Ravello at DevEx on how many health workers in the region have been vaccinated. Are you able to respond to that one, Dr. Escalante?
Thank you so much, Liv. So Jenny, although data is not available from all countries and areas in the Western Pacific region, we know that around 80% of healthcare workers are now fully vaccinated, and this is more than 10.4 million of the healthcare workers. We also know that all countries and areas across the region have now secured enough doses to cover all the healthcare workers, which is 26 million people.
Thanks so much, Dr. Escalante, and also, of course, Dr. Kasai, Dr. Matsui. Thanks all the journalists who have been connected online today. We had lots and lots and lots of great questions. We got to as many of them as we could within the hour and a little bit beyond. If you have any other burning questions that we didn't manage to get to, please be in touch with us and we'll try to get back to you as soon as we can. Until next time, stay safe and thank you very much.